COVID-19, is it over yet? So
yes.
So yeah, you'll probably all be very well aware. In the UK, the number of cases and the number of deaths and hospitalisations are they're low, and they've been low for a little while now, which is fantastic news. We're progressing through the roadmap laid out by the government. If you're not sure what's on the roadmap, there's a link at the bottom. On the BBC, they did an explainer, and they tell you what's allowed at each stage. So at the moment, we're allowed haircuts, we're allowed weddings, and we're allowed to stay in holiday cabins as long as it's just your family and your bubble.
That's the whole wedding package right there. You need a haircut.
Yeah. Is it the same one? No, I don't think it's the same one in Auckland. Still waiting to hear back about pubs. I'll be quite excited about that one. So yeah, in the UK, it is looking pretty positive, but obviously outside the UK, there's the Kent variant has been causing a huge amount of trouble, and because there's still high rates in other countries, we do just need to be aware that it's possible that new mutations can surface. So we're doing well, but we need to just not get too complacent. Another success story is the vaccination program is going really, really well. So in the graph, I just pulled up the data a couple of days ago. If you see that, like the dashed line, that's the total population of the UK, so 67 million. The grey lines are people that have had the first dose. So it's about half of the UK have had their first dose now, which is great. And the first dose, based on some real world data from Israel on the Pfizer vaccine, they reckon that just the first dose, you get 58% protection against infection, 76% against hospital admission, and 77% against death. And that's really good numbers. And that's real world data. So that's not a clinical trial, that's from the whole country, which shows that the vaccine is working as we predicted it would from the clinical trials. And the number of people getting their second dose, it's already coming up to 1 in 4 people, which is really good news. And obviously, these percentages, that's for people that have been exposed. So with the numbers of cases being so much lower than they were, your chance of exposure in the first place is a lot lower now. So we're starting to do all right, I think. Was there anything else you wanted to say about COVID before we move on?
I just a thing I heard this morning. There's something they're calling the Indian variant, in addition to the what was the other variant they were talking about? They were talking about a couple of variants, and they are in the UK. We can see them, and current tracking data is that they're making no impression on the vaccines. So it's good news that our vaccines are protecting us from the current variants that are in the UK. So it's still, as you say, still something to keep a close eye on, but it's looking good at the moment.
Yeah. So after this month, I think probably what we'll do is go back to having a quite a minimal COVID update, because unless there's anything specific to tell, we'll probably just sort of say, yeah, still low, still no new variants of concern.
You're just trying to keep me out of the patient meetings, aren't you? That's what it is.
Oh no, you're
getting rid of my
talk. You've got the second half today. Yeah. Okay, so for a bit of a little bit of a end of the main part of COVID, I thought it would be a little bit interesting to talk. Let me just share my screen again. I thought it would be interesting to have a look at how, obviously, COVID is one pandemic. It's been the one that's been on all of our minds the last year or two. But how does it compare with other pandemics, and how does it interact with other infectious diseases? Because it's not the only thing that humankind has had to deal with. So I found this lovely infographic, and looking at the death toll for different plagues, mostly a lot of historical ones. So if you have a look on the top right hand corner, the one that's not labelled with the red bubbles, that's COVID. That's how big COVID is. So it's over 3 million now, which obviously is horrific. And so it's similar-ish in death rate to, if you see at the bottom left, the plague in 1666, the one that was ended by the fire of London in London. It's sort of comparable to that. And then if you have a look at the bottom right, SARS and MERS, those are the other two coronaviruses that we've been aware that we've tracked in recent years. So you can see that like they were big news at the time, but actually the number of people were much smaller. If you where it says coronavirus at the bottom, this is kind of an older infographic, so that's not the current numbers. This was made, I think, sometime last year. The other interesting one to see, well, they're all interesting, but if you see on the lower level, the Russian flu, the red one, that was sort of late Victorian kind of times. There's a suggestion actually that might have been a coronavirus as well, because there was a lot more like sort of neurological symptoms. And actually, when you look at the molecular genetics of circulating coronaviruses in humans and in cows, it looks like there was something that hopped over from humans to cows around that, almost exactly that year. So sometimes you, so the point of saying that was sometimes in the paper you might see, oh, this is the third coronavirus that's gone worldwide. We don't actually know that because prior to the Spanish flu, we didn't necessarily know what was causing things. So a lot of it's sort of by inference from the symptoms, or in some cases we've managed to get some DNA evidence. But some things we don't always know, like way back in history, we don't always know what caused them. And obviously, yeah, the ones at the top are the heavy hitters, like the Black Death, smallpox, Spanish flu.
It's worth mentioning that the Black Death in the 1300s, 200 million is about a third of the population of the world at the time.
Yeah.
So that's kind of equivalent to what, 3 billion now?
Yeah. So this is absolute numbers. So yeah, obviously out of a smaller population is absolutely horrific. And also, I'm just going to mention it on the way past, HIV/AIDS. It's still a big problem. I think we've kind of, the world's kind of got their heads around it a bit now, but it's still a very big problem, and a lot of fungal infections, so things like cryptococcal meningitis, any kind of opportunistic infections. A lot of people suffering from fungal infections, it's because their immunity is impaired because they've got HIV. So if we can, we still need to keep in mind that HIV is a problem and keep on funding it, keep on trying to cure it, and prevent people getting things like cryptomeningitis in the first place would be fantastic.
In particular, it's even more tragic than that, isn't it? Because AIDS is now really a disease of neglect.
Yeah.
In the developed world, we've got good treatment for AIDS.
Yeah.
But it's a big problem, as you're saying, in places like Africa, where they're treated, so they're getting all these other infections.
Yeah, it's still important. But the like that makes it all seem a bit scary. But a different infographic made by the University of Oxford, as part of, so it's World Immunisation Week. Is it this week or last week? I forget. They've made a lovely figure showing different very common infectious diseases in the 1900s and a couple of years ago, and you can see infectious disease, it's such a much smaller problem these days. There's so many fewer people catching things. Like, I mean, obviously smallpox has been eradicated. Polio, I think probably everybody heard, but that's been eradicated from mainland Africa this year, which is fantastic news. And things, yeah, measles, mumps, rubella, and things like diphtheria. So few people get it now, and this is fantastic. And it is primarily because of vaccination and hygiene. So we're on the way there. So how has COVID compared to other viruses that it's kind of in a similar-ish category to? So depending on which Facebook groups and who you're friends with on Facebook, you might have heard people circulating the misinformation saying that, oh, COVID, it's no worse than normal flu and no one complains about that. And it just isn't true. So there's different ways of measuring how many people had COVID, how many people died of COVID. And obviously things evolved through the course of the pandemic, and we call it different metrics, just different measures. And none of them are perfect, but when taken together, they all very, very strongly agree COVID was much worse than normal flu. That's not to say that normal flu isn't serious. I mean, it does kill a lot of people every year, so it's really important that people get vaccinated, especially older people. I've just realised I left, actually that orange, that's a pomander, that's not a virus, that's not meant to be there. Oh well, it looks like one.
It's pretty good representation.
Those are little cloves stuck in it. Yeah. So yeah, so in the UK, like flu, it does vary quite a bit from year to year, depending on which strain is predominant at any given time. But there are still in the tens of thousands of deaths annually from flu in the UK, which I think we can improve on if we get vaccination rates up. But you can see on the graph on the upper left one, the blue line, the baseline, that's sort of that's a kind of mathematical what you would expect in each over the different seasons. And the black line is how many deaths there actually were. And you can see most years it more or less hugs the blue baseline. But last year there's been this huge spike. And so those are the excess deaths. So we know that COVID has been worse than normal flu for sure. But interestingly, it did give us a very, very, very mild flu season, which is just something that is completely new. We've never seen this happen before. Oh, hang on. I think I put a number on there. Oh, never mind. So you can see the graph on the left. The red line was flu cases, and you can see that round about February time, there were loads of cases, so about 25,000 cases. And when COVID arose, and obviously the world shut down, the flu season just stopped. It just all the way down to pretty much zero, and then stayed there. We lost the end of that flu season. And then we didn't have one last year, which is pretty good news. And actually, the number of flu deaths had already come down around about the turn of the millennium, because that's when we started vaccinating against it. So that had already dropped flu deaths down by maybe about half. And yeah, so last winter was a very mild flu season. So I'm just going to say explain a little bit more about how that it's a little bit complicated when you look at mortality rates. So a lot of countries, when they report influenza deaths, it's not always quite straightforward to get hold of exactly what the number was, because the mortality rates, they're often counted together with pneumonia. So pneumonia, it's an infection. It can be caused by different things, by viruses or bacteria or fungi. So it's when you have an infection and the air sacs at the bottom of your lungs, your little alveoli, they get inflamed and they fill with sort of fluid or pus kind of liquid. So influenza and pneumonia, they're not exactly the same thing. So influenza is a viral infection, and if it gets very severe, you develop pneumonia. But you can also get pneumonia from things like Streptococcus pneumoniae or Haemophilus influenzae, or there's one called Mycoplasma pneumonia, which tends to be a bit milder, so they call it walking pneumonia. And I've just put a little picture in the top right. So this is a scan from the Mayo Clinic, and it just shows on a scan what pneumonia looks like in a lung. So it what you want lungs to be like a sort of a nice dark charcoal grey colour, and you can see the arrows pointing to this kind of white mass where all the fluid is blocking the x-rays. So just the upshot of this is, yes, there are different ways of counting influenza deaths. There's different ways of counting COVID deaths. And yeah, no measure is perfect. It is genuinely a difficult job putting statistics together. But COVID is definitely worse than normal flu. But what we don't know very much about is once the world opens up stuff. So obviously last winter, everything was in lockdown. People had masks on, staying at home, working from home, schools closed, which was great for flu numbers. But this year, those factors probably aren't really going to be in place anymore. Something drastic happens, which I really hope not, touch wood. Yeah. So a word that you might have heard bandied around in the last couple of weeks is a twindemic. So what that means is this winter, as we're sort of circulating a bit more with each other, is it possible that we'll see a seasonal flu spike and also a spike in COVID cases at the same time? So obviously this would be really bad, because both sets of people would be wanting the same hospital bed, basically. So there's been quite a lot of speculation to do with this, but really it is very much speculation. This is completely uncharted territory. We just do not know what how those two are going to influence each other, because there's lots of different factors involved. So the picture there, the one on the right is the COVID, and the one on the left is normal influenza. So we don't know whether they're going to love each other or hate each other, as it were. So with having such a mild flu season this year, it sounds, obviously it's good for the people that didn't catch it, but we don't know how that's going to influence what the flu numbers look like this winter. So the big problem is, because there isn't so much circulating now in the southern hemisphere, we don't know which strains are likely to be the dominant ones in the northern hemisphere once it comes around to October. So for us producing our vaccine, we're a lot less certain about knowing which strains to include. So the flu vaccine, it normally contains 3 or 4 different flu strains, and you're making an educated guess about which ones are going to be the right ones. But it's an educated guess. It's not guaranteed. And so you can have things happen like you can have a flu season where one's dominant at the start and then you get another one that becomes dominant later. You know, it's just hard. It's difficult to predict. And this year we have less confidence than normal. Still worth getting the vaccine very much, but there is that uncertainty. I've also seen people speculating, will it cause, like, because we haven't had the amount of people exposed to it last year, could it be that we sort of have less natural immunity among the population? I don't think that's really, I've not seen that any data supporting that. I think that's very much speculation. And also, if there's fewer people having flu last year, does that mean that it's had fewer opportunities to mutate, like fewer evolutionary steps? So will there be fewer new mutated versions around? We don't know. That's also very speculative. So, yeah, don't. It's just something that we want to watch for. And we don't know how people are going to behave. So now that people, like if before coronavirus, if you suggested that people should wear masks on public transport, people would have been up in arms about that. But we don't know how much this is going to affect just how people behave. Like, are we going to see more people working from home now that we know we can? Now that everyone's on Zoom, is that something that's going to stick? Are people going to be just generally more aware of hygiene and washing their hands? With the Spanish flu, people had quite a short memory, as it turned out. Like, they had a lot of, they obviously, like, masks and hygiene were very big at the time, but it didn't take them that long to forget and go back to normal. So, yeah, you can control your own masks and hand washing, but you can't always control other people, unfortunately.
That Spanish flu strain is still with us, isn't it?
Yeah.
100 years later, it's still circulating. Yes. Isn't that H1N1, the Spanish flu? Have I got that wrong? I
can't remember which number it is, but yeah, some of the seasonal flu strain, and things recombine as well, so you get things shuffling. So yeah, the Spanish flu is still with us, and like I was saying before, the Russian flu, that is the one that they think might be coronavirus. They think that might have evolved into just one of the common colds that we get now. So things tend to, they get milder, but they don't always go away.
That's right, you were careful.
No, that was a really good point.
So we know the flu vaccines, we have to have 5 flu vaccines in a shot, and they're about 60-70% effective. Next year, there might be less. And yet, in 9 months, we've developed a vaccine to a coronavirus that's 90-95% effective. Why do you think we can't have the same sort of impact on flu that we have on coronavirus?
Funding, I would guess. I mean, what it would be amazing to see is if we could get they call it like pan coronavirus, so like a vaccine that targets coronaviruses as a whole, or influenza as a whole. That would be fantastic. Then we would have a chance to really shake free of it, I think. But that's always been kind of seen as, oh, it would be so expensive to develop that, it's not really
But now feasible. We've demonstrated that we have this really good, albeit it might still be about funding, we've got this really fast way of developing vaccines that I don't think we've used for flu before. Maybe that will have an impact. The new technology in the vaccines will be transferable, and just the amount of public interest in it, I think, is much suddenly
bigger.
£50 million for a vaccine doesn't seem like much of a cost. Whereas in the past, they would have struggled to hold clinical trial for a flu vaccine, for example.
Definitely, yeah.
Beth, can I just ask, the drop in flu, is that worldwide?
Yes.
Yes.
Right.
Yeah.
And also, it's not just flu, it is all respiratory viruses. When we all get the common cold, it can be any one of 4 different types of virus, and all of them have reduced to almost nothing. There were no flu, there was no influenza in the UK in the month of January, I think it was, January, February time. But when you considering 2 years ago there were 29,000 cases, that's an enormous, and it's because we're locked away in our homes, but maybe not so much as we were in the summer, because an awful lot of us still went out to work. Because the wearing of the face masks, the hand washing, has been incredibly effective at reducing influenza. So maybe some of us will carry on doing that, like you've been saying, for a year or more.
If there hasn't been any flu or any particular kinds of cold for that length of time, is there any likelihood that it won't rise up as much as it normally does because it's not being passed around everywhere?
I think it's really too early to say. I mean, the thing is, as soon as a new strain mutates that we're all susceptible to, we'll have a proper wave of it. It's just how quickly that will happen.
And it'll come in from abroad and places like that. We've all seen how easy it is to get a respiratory virus moving into the country and infecting millions of people.
Especially on aeroplanes where everyone's breathing in each other's dry air.
Yes.
So, it will be really, really interesting to see what happens this winter. One thing that would be very interesting to see is, so each year, so when you think about flu, there is usually a dominant strain, which I think we don't know all that much about why that happens, but it does seem like one will become dominant and it's almost like it's keeping other ones out. So whether there'll be some sort of inhibition between coronavirus and influenza viruses, that will be, I think there's going to be a lot of scientists all around the world with their eyes peeled for the next year or two.
We've seen it with coronaviruses, direct competition for infection of cells. Once the cell is infected, it becomes resistant to other strains of the same virus. So it could be.
Yeah, and different strains displacing each other.
Yeah. We've all learned such a lot about virology in the last 12 months, haven't we?
Oh, I know, yeah. And the level of public knowledge is absolutely fantastic now. Because like before, if you'd have tried to explain to just the average person in the street, what's the difference between a lateral flow test and a PCR test? Most people would have looked at you like you had two heads. But people know these things now. They understand so much more about vaccines and diagnostics. So it's a small silver lining. It's not really worth it, but take your wins where you can sometimes.
Actually, there's the other point I meant to make about COVID. The other bit I read this morning was the level of risk to all of us is now below 1 in 2,000 on any one day. But in the north of England, it's still around. It is around 1 in 2,000. In the south, it's around 1 in 6,000. So depending on where you live, there are differences in risks. Although now the risk is really, really low. But you can still find it's a little bit patchy. There was a patch over in Hull last week, and I think there's a patch somewhere further north, maybe in Scotland this week. And you can see it on the map on the BBC website that we've looked at before. So if you just go to news on the BBC website and then click on coronavirus, you get these maps, and you can see if your area is particularly high or relatively high. I know Cheshire at the moment is only something like 40 cases in the whole of Cheshire now, so it's really, really low, but other places are about 250. So it's worth checking for your area what the risk still is using that resource.
How did you know I was going to put that on the next slide?
Ah, sorry.
Great minds. Yeah.
So I've just blown you out of the water.
No. That was exactly what I wanted to say.
All right. Okay.
Yeah. So in terms of what can we do? So the second point is stay aware of COVID rates in your area, and if there's, probably there'll be new mutations, then hope there won't be any further full waves, but the situation will continue to evolve, and keep an eye on your area, and you might want to increase your safety measures that you do personally. You can do that at any time. You don't have to wait, obviously, for the government to bring in restrictions. And I know sometimes it can be a bit embarrassing, like being the only one wearing a mask, but it's absolutely nothing to be embarrassed about.
I think it's become a lot more socially acceptable now compared to a year ago, hasn't it?
Definitely, yeah. And it's just because it's just worth remembering that about 1 in 3 detected cases are asymptomatic. So 1 out of the 3 people that have it, they won't know they've got it, and they'll still be going to Tesco's, getting on the bus. So
is it just Tesco's?
Maybe Asda as well. I'm sure they
All the
don't.
supermarkets.
Waitrose, no chance. Asda, definitely.
Yeah, but yeah, if you've got concerns, just do not be shy about self-protection measures.
Which
really.
it's still about washing your hands as well as the face mask.
Yes.
Essentially.
Yeah.
And spacing.
Yeah, or thinking about like what events you go to, like particularly large events or ones where you think it's a bit risky. You can always do more than what the government says if you want, or do it sooner. You can take vitamin D supplements. That's something we just generally recommend. Another thing you can do is to be proactive with all of your vaccinations. So as well as definitely remember to go back and get the second dose of your COVID vaccine, because you hear stories about people getting the first one and then thinking, that's probably all right, and I'm quite busy and sort of life getting in the way, but definitely go back for the second one. It might be worth, a lot depends on sort of your own GP, your own pharmacy. It's worth us like being a bit proactive and seeing if you can get your flu jab as early in the season as possible. So like if you wait to November and then think, oh, I haven't had a letter, and it can drag on and you can get flu while you're waiting. So some places you can get it before October, but that'll depend on your local doctor. Another thing that will depend locally is if you need something special like the egg-free flu jab, it's worth asking about that early, because I know some people last year, they found that when they tried to go in for it, there wasn't any, and then it had to be ordered, and there was problems with the supply. So ask sooner rather than later for those flu jabs. And if you have any other vaccinations that you've been recommended, it's really important that you don't sort of just wait for a letter to be sent or wait for somebody to prompt you. Just know exactly which ones you're recommended to have, when you had your last one, and when the next one's due. Because and sometimes it'll depend on exactly, some of them have different schedules. So some of them are like once, and then you have it once, and then you're that's all you need. Sometimes it's every 5 years, and every 5 years is quite a difficult one to remember, because by 5 years later, you can't really remember what's happened. So for NAC patients, I actually spoke to the nurses and the pharmacists this morning to ask which ones we recommend for patients. So actually, we used to recommend a kind of a blanket set for everybody with aspergillosis. We don't do that anymore. It's tailored. Nowadays, we do it tailored to you specifically. So if you're not sure which ones you're meant to get, that's something to ask when you have an appointment. And then, and just keep. I don't know if people still keep vaccination cards anymore. It's quite an old-fashioned thing, but they're pretty good. So be proactive, because you might not get a reminder externally. And just kind of try not to worry. Like, there's so much uncertainty with how COVID is going to be a year from now, 5 years, 10 years from now. We don't know. People are speculating, and it's just such an overheated area of discussion, and we don't really know what's going to happen. But it's good to just sort of keep it in proportion to other things.
There was talk about boosters in the autumn for COVID, for the jab, at the same time as doing the flu. Is it likely that would be at your doctors, or do you think they're going to have centres to do it again? In which case, will they do both at the same time?
I don't think there's any.
Or would you go to the doctors for one as soon as you could and then just wait to be called for the COVID?
I don't think we know yet. I think in the long term, like not so much this year, but sort of future years going forwards, I would imagine they would want to do them both together at your GP. But like this autumn, I don't think there's. I've not heard anything about a concrete plan at all.
I think we've got two separate systems set up, haven't we?
Yeah.
So that if we're going to have a COVID booster, they're going to have to inoculate 30 million people as quickly as we can. So that's going to go through the current COVID system, which is all these centres all over the country. Flu is a much more targeted vaccine, so I imagine that will go as normal through your GP. But as you say, in future years, I think they'll try and harmonise that and try and just identify the highly vulnerable groups and vaccinate those, I would have thought.
Yeah.
But your doctor will let you know close to the time. We don't even know if we're going to need this booster shot yet.
Yeah. Yeah, I'm sure it'll be all, like, as soon as any information is available, it will be all over the newspapers and social media. It'll probably be difficult not to hear about it.